Instances of medical negligences: when patient makes a request to doctor, failure to attend to patient in emergencies, admit admit patients requiring urgent hospitalization, attend to patient in time, attend altogether. So when patient makes a request to doctor, failure to attend to patient in emergency, admit patient requiring urgent hospitalization, attend to patient in time, attend altogether, attend altogether. Patient refuses treatment, failure to inform him of risk of refusal. In doctor's clinic, failure to obtain the informed consent, examine patient himself, order X-ray examination where the patient history suggests the possibility of fracture, dislocation of foreign body in a wound, making wrong diagnosis due to absence of skill and care, conduct sensitivity test before administering drug known to cause allergic reaction, performing more tasks than the patient consented for. Even if additional treatment or surgery is beneficial, the doctor must take a consent from patient. Even if additional treatment or surgery is beneficial, doctor must take consent from the patient also. That is important. Special test and consultation: unprofessionally performed procedures, poisoning by barium enema, traumatic rupture of rectum during barium enema, failure to read X-ray film correctly, have an X-ray, CT, MRI, and ultrasound interpret from a competent person, obtain consultation from a competent specialist where appropriate. Before patient leaves a clinic, a failure to give a proper instruction and warn the patients of side effect of drugs. Admitted patients: failure to isolate a patient with an infectious disease can cause other patients to catch disease. To delegate the duty of treating or operating upon a patient to another doctor without the consent of the patient. Experimenting on patient without consent, keeping the patient unabsorbed during admission, administering treatment recklessly and without proper monitoring electric equipment, heating parts, hot water parts, producing burns in an unobserved patient. Blood transfusion: failure to match before transfusion, administering infected blood, failure to monitor reaction, blood hazard, giving overdose of medicine, giving excessive antidote to a poisoned patient, giving poisonous medicines carelessly, prematurely discharging the patient. During operation, procedures conducted with negligence, continuing a dangerous procedure despite it have been proved wrong and time and again, allergenic diseases, post-operative and post-discharge, failure to give proper post-operative care, failure to inform patient of the possible side effect, neoplasia of long-term use of drugs, iodine 311 therapy, thyroid cancer, chlorinaphin phenacity, urinary tract carcinoma, contraceptive steroid, liver adenoma in female if continued inadvertently during pregnancy, infant may develop a liver tumor, diethyl stilbestrol, clear carcinoma of vagina, vaginal adenosis, radiation, local application of radioactive material, neoplasia, leukemia, stilbestrol, breast cancer, thorium dioxide, hemangioendothelium of liver, failure to keep a track of adverse reaction caused by long-term usage of drugs, preventive, failure to immunize, failure to perform sensitivity tests, general, failure to provide a substitute during his absence, failure to keep himself well informed of advances in medical sciences, fetal and neonatal death in utero caused by drug administered to pregnant mother, diabetes, dicumarol, iodide, surpass thiazide, diuretic, vitamin K synthetic. Thank you.